Good morning. Welcome to this month's episode of Empowerment Sunday. We have an interesting discussion, and the topic is hypertension, a silent killer. This is a very good topic, and we have two doctors here that are going to educate us on, you know, hypertension being a silent killer. My name is Joyce Kwate, and I'm a registered nurse, and I just want to introduce my panel right now. I have with me Dr. Patience Timmy. She is a first-year medical resident in OBGYN at Vanderbilt University Medical Hospital. She attended medical school at Emory University Medical School in Atlanta, Georgia. She's originally from Maryland. And then I have with me on my left side Dr. Tiwa Akinshola. She's a fourth-year medical resident in urology at University Medical Center also. She attended medical school at University of Pittsburgh School of Medicine in Pennsylvania. She's originally from Cincinnati, Ohio. So, according to the American Heart Association, 84 million Americans, that is 34% of the population, have hypertension. In addition, this affects Black race worse than other ethnicities. So we are going to define hypertension and what brings it on and how to manage it. So we are going to answer some questions that would enlighten us on hypertension. So the first one is, how would you define hypertension? And I would ask Dr. Tiwa to explain that to us.
So hypertension, it's defined as having a blood pressure above 130/80. So your blood pressure, there's two components. There's the top number, which is your systolic blood pressure, and then the bottom number, which is your diastolic blood pressure. So those are the two parts that kind of complete what your blood pressure looks like. So if you have a blood pressure that's consistently above 130/80, then that's how you get the diagnosis. And it's usually made if you're in the hospital or if you're seeing your primary care or your GP in clinic. That's usually how the diagnosis is made.
Thank you. The second question is, how many types of hypertension do we have? And then please explain that to us.
Yeah, so there are essentially two different types of hypertension. There's primary and then there's secondary. For primary or essential hypertension, that's hypertension that is onset, just newly onset, has no cause, primarily just high blood pressure. Secondary hypertension is caused by something else, so mainly, for example, a kidney issue can cause high blood pressure. Certain medications can cause high blood pressure. Hormonal issues and imbalances can cause high blood pressure.
Okay, thank you. Also, the next question I'm going to ask is, why is hypertension considered a silent killer? Dr. Tiwa, if you can enlighten us on that.
It's considered a silent killer because it doesn't cause any symptoms until it gets very severe. So a lot of people are walking around and they have high blood pressure, but they won't know it because they feel normal. They feel like their normal self. But over time, that high blood pressure causes a lot of damage to your other organs. And by the time it becomes symptomatic, you are already too far gone down that path. So that's why it's really important to see your primary care doctor and get diagnosed with it before it leads to more detrimental things later in life that unfortunately you can't take back once those things set in.
Okay, do you want to add anything, or we should just go on to the next question? We can go to, okay. So how does hypertension damage organs, and what organs are particularly at risk?
Yeah, so hypertension is mainly damage to your arteries, so the main vessels that pump blood to your vital organs. And when you have hypertension, those arteries stiffen, they get damaged, and that can cause decreased blood flow to these vital organs, so mainly your brain, your heart, your kidneys. And that is why hypertension can cause things like heart attack or stroke, kidney failure. It can even cause many liver issues, liver failure.
Okay. I also know that, do you want to add something before I just say something else? Okay. I also know that hypertension also can lead to visual loss and sexual dysfunction as well. And sometimes also like vascular dementia. So hypertension does a lot of damage to our organs. So going on to the next one, I would ask, how does hypertension affect pregnancy? And I think that one will go to you since you are the OBGYN.
So high blood pressure is actually one of the leading causes of maternal morbidity and mortality in pregnancy. We worry about high blood pressure because of its high risk of causing things like preeclampsia. And preeclampsia is severe high blood pressure in pregnancy that damages your placenta and your the blood flow to the baby, the appropriate nutrients that baby would get. And so high blood pressure in pregnancy can pose really detrimental risk to mother and baby. It can actually increase your risk of miscarriages, increase risk of preterm birth, preterm labor, stillbirth. So that's why it's really important to, if you are thinking about trying to get pregnant, trying to conceive, to see your primary care doctor or your OBGYN and make sure that you do not have any issues with high blood pressure before trying to get pregnant in order to manage these before you're at risk.
Okay, so for a follow-up question, if somebody is pregnant, the person was normal, the person doesn't have any high blood pressure, but then develops, high blood pressure during pregnancy, and they put them on medication to help control that. So does it mean that after birth or after delivery, will it go away, or, they are prone to having it in the future?
Yes, unfortunately, if you do end up having high blood pressure in pregnancy, that can increase your risk of having issues with blood pressure in the future, even when you're not pregnant. It could actually increase your risk of having heart failure as well, because pregnancy you can think of as being a stress test to the heart. And so any issues that you have in pregnancy can increase your risk of having it in the future.
All right, thank you. Do you have any other to add?
The only thing I would add to that is I think it's, like she said, it's very important even before childbearing years and, once you're thinking that you want to start a family, just to make sure you're seeing your primary care doctor. Because I think a lot of young people, we tend not to see them because we feel like we're healthy and we don't have to worry about that until we're older. But we, as she said, we commonly see during pregnancy that a lot of those things will come about because they weren't being seen by anyone, so they weren't diagnosed until they're pregnant. And at that point, now you're running into a bunch of other complications and then having to see your doctor more frequently because of that. So it's very, very important to try to stay on top of your health even from a young age.
Thank you. So now we are going to talk about the risk factors that affect hypertension in us. Do you want to start with that?
I can start with a couple. Age, as you get older, your risk of developing high blood pressure is higher, and that's just like many issues, medical issues. And then obesity is also a big issue. It has been shown that people who have a higher body mass index are at higher risk of developing high blood pressure. So the main things that we recommend to combat obesity is having a proper diet, regularly exercising, about 30 minutes of exercise, high intensity exercise every day if you can.
And then some other things too, they've linked high salt in your diet as a risk factor as well. So things you can try to do is limit your salt. That doesn't mean completely cut it out of your diet, but try to limit it as best that you can. And then also family, if you have a lot of people in your family have high blood pressure, there's a high chance that you will get it too, because it can be hereditary. And then we kind of talked about this at the beginning, but African Americans are at they have a higher rate of high blood pressure. And that is not exactly known. It could be from social or environmental factors, or it could also be linked genetically too.
And having them said all that, I just want to add a few points to it. Like excessive alcohol intake can also increase your blood pressure. Then tobacco use or vaping can also affect blood pressure as well. So having talked about the risk factors, now let's talk about how do you control it. Do you understand?
Yeah, I can start. And one other thing we forgot to mention too is stress. So stress can also lead to high blood pressure, especially stress over long periods of time. So things that you can do to combat that, or try to limit your stress as best you can, which I know is very difficult for most people in this room who have children or have stressful jobs, but trying to find ways to keep your stress or your anxiety at a lower rate can be very helpful. And I think that is different for most people, but I think for everyone in this room, leaning on God during stressful times, I think can be very beneficial. So trying to release your stress and hand it over to Him can be very helpful, not just in whatever's stressing you out, but for your health in general. And some other things you can do, we kind of talked about diet already, but trying to have a healthier diet, putting low salt in your diet, and then just generally eating more fruits and vegetables versus fatty foods or processed foods can also help. And then exercising as well. So if you have a more physical activity just regularly in your routine, you're spending more time walking and standing than sitting. If you work in a job where you're sitting all the time, people will sometimes get desks that they can stand and do work, or they take the stairs instead of taking the elevator. So there's little things that you can do that may not seem like they're gonna help, but long term they can really make a big difference.
Okay, do you want to add to that? Okay, I just want to say one or two points in addition. So, like I talked about earlier on, that smoking also brings on hypertension. You have to quit smoking, and I know most of us here don't, but if you do, you have to stop, because that would also help bring it down. And then also, if you are diagnosed with hypertension, you have to be compliant with your medications. A lot of people don't want to take their medications, and hypertension is such that you don't really feel any symptoms in most people. So they wake up and they're like, today I feel so good, I don't feel anything, so I don't want to take my medication. So if you don't take your medication, that would increase it, and it's not good. And as they explained earlier on, that would, cause damages in your body. So please, if you have hypertension, if you've been diagnosed with it, and your doctor prescribes you the medication, please take it as it is prescribed. Don't skip your doses, or don't say, I don't feel like taking it, so I'm not taking it. So please. Oh, you have a question for us? Okay.
Just between 140 and 90, and it was there for a long time, and my doctor would say it's okay, but when I got to this place, they said it's not okay. And we find out that they say, I rejected the blood of Jesus has healed me. This are they really healthy things that we're supposed to do?
That was a great question. I think that here in the U.S., I think a lot of that why they say 140 over 90, which is what it used to be, and now they're even saying 130 over 80 is considered high blood pressure. It's just based off of data and research that they've looked into it, that they've shown at those levels that is when you can start having bad effects on your body when your blood pressure is persistently that high. To your point of, do you have to take those medications forever? There are some people as they get older that they no longer have to be on those blood pressure medications, but you won't know that unless you're seeing your doctors more regularly, because they're the ones who are advising you when you should and when you should stop a medication. Because kind of like we've been saying, you won't know really, you can't feel what your blood pressure is unless you actually take it and test it. So it's very important to stay kind of seeing your doctor regularly. Most of the time they want to see you every year. Sometimes if you have other health issues, they want to see you more frequently. But they are the ones who are supposed to kind of help guide you with those decisions. Sometimes they can lower your dose if you've made a lot of diet changes or you're living a healthier lifestyle and you bring it down that way. Or they can take you off of it completely if you've made enough changes that you kind of help bring your blood pressure down on your own. But at the end of the day, I would say they're ultimately the ones who are supposed to help you in making those choices.
Okay, we'll take a few more questions and then we would open the floor for more questions. So I just want to ask, what is hypertensive crisis? Hypertensive crisis.
So it's when your blood pressure is above, that top number is above 180 or the bottom number is above 120. A lot of the time when someone has hypertensive crisis, they're also having symptoms in addition to that really high blood pressure. So if you ever notice you're having a headache or you're feeling weak or dizzy, and you're in a place where you can get your blood pressure taken, I would say that's a first step, is seeing if someone can take your blood pressure for you. Or if you're not in a scenario where you could do that, try to get to either your doctor's office, urgent care, or emergency department if you're having those types of symptoms. Because we know that if your blood pressure gets too high, it can cause you to pass out, it can cause you to have long-term effects because it gets way too high, way too fast. So if you ever have your blood pressure that high and you're having those symptoms, you need to see a provider immediately.
And to add to that, like she's already explained, if you already have like the high blood pressure or hypertension and they prescribe you your medication, if you don't take, you are not med compliant. That is, if you don't take the medication, that can lead to the hypertensive crisis. So once again, please, when they prescribe you your medication, adhere to it and take it as prescribed. And then the next one would be, how do you get diagnosed with hypertension? And the reason why I'm asking that is, some people get very anxious maybe when they go to the doctor's office for any checkup or anything. They get there and they are so anxious, so they take it and then maybe it's so high, but normally at home it's okay. So, like, how does the doctor really diagnose one for hypertension?
Yeah, so most of the time it isn't just one blood pressure that would meet criteria for high blood pressure. It would have to be multiple blood pressures, either at home that you do, that you take with your home blood pressure cuff, and then you tell your doctor what these blood pressures have been, or multiple office appointments where your blood pressure was persistently high.
And then to add to that too, like if you're in the hospital, they're taking your blood pressure pretty regularly. So that's another way that some people are diagnosed, is that they've been in the hospital for something else, but they've noticed that their blood pressure is persistently high. Some of that can be related to the illness that they're there for, but that's something that they usually recommend you follow up closely with your primary care doctor, so that way they can kind of look into it further.
All right, thank you. So the next question I'm going to ask is, what does the blood pressure means? Like the top, we've been talking about numbers. What does the top value means or the lower value means?
So there are two numbers with your blood pressure. Like we've been saying, 120 over 80 is generally a normal blood pressure. That top number is what's called your systolic blood pressure, or the highest point of pressure that is pumping out of your heart against your blood vessels, that pressure. And then that bottom number is called your diastolic blood pressure, so your resting pressure in your blood vessels.
All right, so thank you. I think we'll now open the floor for questions. So if you have any questions, this is the time to do so.
Praise the Lord. Yeah, I have two questions. The first one is about the side effect of the medication. My second question has to do with children. When is the right time to be concerned if you notice that maybe a teenager is having high blood pressure?
And for the first question about the side effects, I think different high blood pressure medications will have different side effects. So I think when you're meeting with your primary care doctor or your GP and they say, oh, I want to start you on amlodipine, or they want to start you on something, just talk with them about, hey, what are the side effects of this medication and what should I be on the lookout for? Because a lot of the time, you won't know. You can go to Google. Google will tell you everything is a side effect. So I think talking with your doctor specifically about the medication you're on, that way you know what to look out for, because they should be willing to go through that with you and then also switch you to a different one if you're not tolerating the one that you're taking. And then in terms of when to be concerned about your children, I think that's a great question, because most kids, their blood pressure is normal. So if you're noticing that your child, their blood pressure, like let's say you go to Walmart or you're just seeing them with their pediatrician and their blood pressure is elevated, I think that's something to bring to concern with your pediatrician, because the earlier that starts in life, the more likely they're going to have issues down the road if you don't get it under control at an earlier age. And we're seeing younger and younger people who have to be on medication to get their blood pressure controlled. But sometimes we find that it's not essential hypertension, but it's being caused by something else. So if you notice that your child has a high blood pressure that's not characteristic for your child, something really important to bring up to your pediatrician, so that way they can make sure there's no other reason why your child would be having a high blood pressure.
Just for a follow-up question with what you said about the side effects of the medications. I know most of these medications have side effects. So if they prescribe you one and then maybe you go home, you take it and you have all these side effects, do you stop your medication? Because I know some people will be like, oh, I didn't like the side effects, so I stopped taking my medication. Is it a good idea to do that?
I would say no, it's not a good idea to stop it without telling anybody, right? So I think if your side effects are so severe, I think it makes sense to stop it, but I think you need to let your provider know so that way they can prescribe you something else. A lot of the time we find with all medications, we'll see someone in clinic and it was 3 months ago we prescribed something. A week into it, they said, well, I was having these symptoms, so I stopped taking it, but they never let anyone know. So that's, 2.5 months that we could have tried something else, and now they're kind of back to square one. So I think it's really important to, if you have side effects, definitely let your provider know so that way they can switch your medication around. A lot of the time, that doesn't mean you have to come all the way back into their clinic to do that. They can work with you and talk with you over the phone, because I know it's hard for a lot of us to make appointments. So if that happens to you, you don't have to feel like, oh, I need to drive back to my doctor. You can usually call their office and let them know, and then they'll get back in touch with you.
All right, thank you. So to add to what she just said, I just want to add that, when they prescribe you some of this, especially the high blood pressure medications, there are certain precautions that you normally have to take when you are on it. So maybe if you have to, when you lay down, you have to get up, you have to do it slowly. When you have to sit up and then make sure you are okay, and then before you stand up. So, there are certain precautions that you have to take while you are taking the high blood pressure. So can we take any other questions?
When I was younger, like 40s, I'm fasting. Anyway, first of all, I noticed that I had blood pressure when my husband died because of, you know, how it is, what I went through that time. So they started giving me medication, everything. It was okay. So when it is time for fasting, I don't like to take medication. Normally, I don't even like medication, but I have to take it. And when it's time for fasting, I was taking medication. But at the end, I said, let me exercise my faith. I will not take medication again. So I really noticed that when I take my blood pressure, everything will be fine. It's normal. But as I'm growing older, if I'm fasting now, if I don't take medication, you see the everything going up. So why is that? Is it because of the old age or whatever?
Amen. Like we said before, I think regularly taking your medication is important. Even if you're fasting and praying, of course, that can be a prayer point for God to help you control your blood pressure medication. While you're praying, continue taking your blood pressure medication, because at some point, God will answer your prayers, and gradually, you'll be noticing your doctor may be telling you to take less and less, but I would recommend to continue taking your blood pressure medication as regularly as you can. It's the regular, it's the daily medication that allows for your blood pressure to stay stable and under control. If you're taking it every now and then, you'll notice that your blood pressure will be very erratic. But putting it up in prayer is always the best thing.
Hi, praise the Lord. So I want to hone in on this diet part of it, because medication is great, but diet, because some of us like steak, goat meat, beef. Are there any indications about maybe when to stop, when to reduce it, what to eat, what not to eat? Please, thank you.
So I think that what I typically tell people and what I try to tell myself too is that everything in moderation, I think, is a better goal than trying to cut those things out completely. Because we're all human. We like goat meat. We like what we like. So I think it's very difficult to tell yourself, oh, I'll never eat that again. I think what you can try to do is just eat it every once in a while. So if goat meat is your favorite thing to eat, you can still prepare it in a healthier way, but if you know yourself and you know, okay, no, I only like to eat it this way, then limit it to once a week or once every 2 weeks. And the other times, try to eat things that are low in salt. Try to eat things that have high vegetables, high fruit. Try to lower the amount of carbs that you're putting into your diet, because like we talked about, obesity is a risk factor for having hypertension. Salt is a risk factor for having hypertension. So the healthier you eat, the lower your chances are of having hypertension, or if you have it, there's a good chance that you'll be able to lower your blood pressure just by making those changes. So try not to cut things out completely, because most of the time diets like that usually fail. But if you can just be more disciplined on a day-to-day and let yourself have those things every once in a while, you'll still see good results.
I just want to add to that, because I'm guilty of this as well, but just small steps. So one less Maggie cube, just one less, you'll notice that the food actually tastes the same. Or just a few, less seasoning, you'll notice that the food actually tastes the same. Just small steps.
And just to add to it also, like the salt aspect, these days they have a lot of herbal seasonings, which is good, and will make the food taste good, although you don't have a lot of salt in it. Because, some people like salt. Even after the food is cooked, they want to add more salt. So let's stick to a lot of spices that will make our food taste better.
Just like what you said about when we're having taking medication, if the side effect says that bunch of side effects on it, when you're having a dizziness, you went to the doctor, and the medication said that the side effects is dizziness, kind of foggy, or kind of stuff. So mostly, whenever I read the side effect of my medication, I don't take it. So because honestly, I will not take it. And I will tell my doctor that did not take the medication. Can you give me something else? So, but what happened is that recently, I got hit with a football. One of the patients kicked a football into my head. Then last week we went to Dallas. I did not know that the medication that they gave to me, I don't have to drink coffee. And I love coffee. I drink coffee, and I took some of the medication with me. So I took the medication. But by the time I slept, when I get home, I did not even know that it was not the original medication that I took. I took a different one, mixed medication. And I already drink coffee. Thank God, I cannot even sleep. My head was like something, it was kind of a pressure. So then something tells me, and I was Google. Then I went on the Google. I was Googling, drink coffee, what can I eat? I just started Googling everything. Then I realized that I drank coffee. Then I went to Dunkin' Donuts. I drank another coffee. I realized that I drink much of coffee. I cannot even tell my doctor. The neurologist told me that I went for CT scan. Thank God there's no breakage or anything there. So the doctor asked me that, do I want to stay home or something? Because I always work overtime. I'm looking at the money part of it. It's not funny. I need money. So so at the same time, I was doing that. I said, let me go to work so that, I said, okay, let me do light duty. So I was doing light duty. I cannot do overtime. So they are telling me, go this way, go to that place and do this. I'm like, oh, I would have stayed at home. I think they will pay me I have bunch of sick time that I can use. Then I'm like, if I go back to the doctor, I tell him to pull me back so I can stay at home. I think that's what I will do. Next week I will call the doctor that I don't mind to stay at home. But thank God that medication did not, react in my blood. So I hope the medication will not have any reaction because the ones that they gave me Toprimate. Then I'll use Melosicam that the doctor already prescribed for me initially. So I hope there won't be any. Then they asked me to use a Tylenol and not ibuprofen. So I decided not to take ibuprofen because I was having a headache again. But I want to ask a question. Does I don't have high blood pressure. So can somebody have hypertension if you do not have any kind of high blood pressure?
Thank you. So no, and they're kind of interchangeable. So for you to be diagnosed with hypertension, that means your blood pressure is kind of consistently high. But like when you were saying, when you had your episode where you got hit in the head and you were seeing doctors, that's stressful. So your blood pressure could have been high because of that stress. I think it's something to, keep in contact with your primary care doctor and the neurologist that you saw. Once you're doing well and you're healed from this whole event, make sure that they check your blood pressure again and just make sure that it goes back to where it normally is. But anytime you're have an acute illness, it can cause your heart rate to be faster, it can cause your blood pressure to be higher, but that doesn't necessarily mean that you have hypertension.
Good morning. I have is it a question? Yeah, okay. I just want you to tell us about, because I know we are Nigerians and a lot of Nigerians like to cook with either chicken broth or meat broth. and also, one other thing. Yeah, I think that's what I can remember right now. Can you please let us know the effect of this chicken or meat broth on our cholesterol and how it affects hypertension or our blood pressure?
Yeah, so depending on how you make the chicken broth or the meat broth, if it has a lot of seasoning, salty seasoning, salty spices in it, it can increase the pressure in your blood vessels, and that can cause damage to your blood vessels. So that's kind of the mechanism of how it causes high blood pressure. It's the salt content in the food. So it is possible to make chicken broth or meat broth that is healthy. But I think the difficulty is that many of us, in how we grew up, a lot of the healthier ways that we eat food does not taste good. And so adding these salty seasonings, salty spices, salt, taste better to us. But like we talked about, everything in moderation. And kind of retraining your brain and your body to understand that healthy food without all these seasonings and spices actually can taste good.
I think we'll take the last question. I think I saw her hand up.
When you started talking, you made mention of the causes of hypertension, that it can be hereditary or... Now, I'm still concerned about teenagers because I notice some of my students during exams, they develop anxiety, and most of the time when they are sent to the clinic, they have high blood pressure. Should we be concerned in a situation like that when we know that it's only triggered because of the exam? Then, is it possible for patients to know the cause of their hypertension?
I think it's still important, even if it's just in the course of an exam. If a child or a teenager is constantly getting very anxious to the point that their blood pressure is going up, over time it can cause their blood pressure to be higher than what it should be. So learning how to manage their anxiety around test taking is huge. There are lots of different things you can do, but I think it all will depend on the child and what works best for the child. But I think the parents need to be involved, their pediatrician needs to be involved, and the teachers as well, to try to figure out if you're noticing there's one child that is getting anxious to the point that it's having bad effects on their health, that needs to be something that's addressed. And even for adults too, if your anxiety is to that level, you need to address it. And I think it's something that a lot of people, especially in our community, don't want to address a lot of the time, is anxiety, but it can have effects on your blood pressure, but then other things in your life as well.
I think it's time, but I think his hand has been up for a long time, so let's just take that last
Praise
one.
the
and
Lord.
be done. Hallelujah.
My question is, some doctors said hypertension is from the gene, and supposing a father and mother have hypertension, they are both hypertensive, and they have 6 children. Is this all the children that are going to be hypertensive?
No, not necessarily. It just puts each child at higher risk. And so by knowing that, by understanding that, it's important to make lifestyle changes in order to prevent that. But it does not necessarily mean that all 6 children will definitely have high blood pressure. It just means that their chances are slightly higher.
Okay, I think our time is up. I know some people still have questions, but we have to end here. Maybe some other time we'll take more questions. So, having said that, please know your numbers, know what your blood pressure is, and that would help you in the long run. So I just want to thank Dr. Timi and Dr. Kinshola for helping to educate us this morning on hypertension.